Diabetes is often described as a sugar problem, but when doctors look deeper, they see something far more subtle. They see a breakdown in communication. Sugar rises not because the body is careless, but because the cells are no longer hearing insulin clearly. And many physicians now agree that restoring this conversation begins not only with medicine, but with nutritional support that helps the body remember how to function. Doctors frequently point to vitamin D as one of the most overlooked nutrients in people with diabetes. Clinically, low vitamin D levels are strongly linked with insulin resistance and higher A1C. Many endocrinologists recommend checking vitamin D levels and correcting deficiencies because this vitamin helps insulin do its job more effectively. It doesn't push sugar down aggressively, it improves insulin sensitivity quietly, allowing glucose to move into cells instead of lingering in the blood. Thiamine, or vitamin B1, is another nutrient doctors pay close attention to, especially in long-term diabetes. Research shows that high blood sugar increases the loss of B1 through urine, leaving cells unable to process glucose efficiently. Physicians often recommend B1 or its active form because it supports glucose metabolism at the cellular level. When enough B1 is present, sugar is more likely to become energy instead of damage, helping stabilize fasting blood sugar and A1C over time. Vitamin B12 is commonly discussed by doctors, particularly for patients taking metformin. Medical guidelines acknowledge that B12 deficiency can worsen nerve damage and metabolic fatigue. Physicians recommend monitoring B12 levels because it supports nerve health, red blood cell formation, and insulin signaling pathways. Restoring B12 doesn't just protect nerves, it helps the body regain metabolic balance that diabetes slowly erodes. Vitamin C is often recommended by doctors as an antioxidant ally in diabetes care. High blood sugar creates oxidative stress, which damages blood vessels and worsens insulin resistance. Doctors note that vitamin C helps counter this stress and may modestly lower blood glucose and A1C by reducing inflammation and improving cellular glucose handling. It's not a cure, but it supports the environment in which healing becomes possible. What many doctors emphasize is this: vitamins are not replacements for medical treatment, diet, or movement. They are tools that help the body respond better to insulin, reduce hidden stress, and restore biological cooperation. Diabetes is not a failure of willpower. It is a signal that the body needs support, clarity, and nourishment. And when that support is given thoughtfully, blood sugar no longer needs to fight to be heard. When doctors talk about diabetes, they rarely describe it as just a problem with sugar. What they see first is a loss of communication, a subtle breakdown in how the body listens to itself. Blood sugar does not rise overnight, and it does not rise without reason. It rises slowly, patiently, as cells become less responsive to insulin's message. This isn't failure, and it isn't weakness. It is biology adapting under stress, doing the best it can with the signals it's receiving. From a medical perspective, insulin is not simply a hormone that lowers sugar. It is a messenger, moving through the bloodstream, knocking on the doors of muscle, liver, and fat cells, asking them to open and receive glucose. In healthy metabolism, that door opens easily. Glucose enters, energy is made, balance is restored. But over time, inflammation, nutrient deficiencies, poor sleep, and chronic stress can dull that response. The knock becomes quieter, the door heavier, and sugar begins to stay outside, circulating in the blood. Doctors often explain that this is why diabetes is progressive if the underlying communication problem is not addressed. Medication can help manage blood sugar, and for many people it is essential. But clinicians also recognize that numbers improve best when the body's internal environment becomes more cooperative. This is where nutritional status begins to matter, not as an alternative to treatment, but as a foundation that supports it. Before moving further, physicians are careful to clarify one thing. Vitamins and nutrients do not replace medical care, prescribed medication, or individualized advice. They are supportive tools, and their use should always be discussed with a healthcare provider, especially for anyone managing diabetes or taking medication. This isn't about self-treatment, it's about informed support, guided by both science and medical supervision. What doctors observe again and again is that many people with diabetes are quietly deficient in key nutrients that help insulin work effectively. These deficiencies don't always cause obvious symptoms at first. Instead, they show up as rising fasting glucose, stubborn A1C levels, fatigue, and a sense that the body is resisting its own efforts to heal. When these nutrients are restored appropriately, the goal is not to force sugar down, but to help cells respond more clearly to insulin's signal. In clinical practice, this shift in thinking changes the conversation. Diabetes is no longer framed as a battle against sugar, but as a process of restoring clarity inside the body. Doctors begin to look at how well cells hear insulin, how efficiently glucose is used, and how much internal stress the system is carrying. Blood sugar becomes less of an enemy and more of a messenger itself, reflecting what is happening beneath the surface. This approach asks for patience. It respects the body's intelligence. It acknowledges that healing is rarely aggressive, and almost never instant. Instead, it unfolds as the internal environment becomes calmer, better nourished, and more responsive, allowing insulin's message to be received with less resistance, less confusion, and less effort over time as the body slowly remembers how to respond, how to cooperate, how to move toward balance again without being forced, without being rushed, without being overwhelmed by signals it no longer understands but is still trying to follow in its own quiet way. Doctors often turn their attention to vitamin D when blood sugar remains stubbornly high despite efforts with diet, activity, and medication. They do this because vitamin D is not just a nutrient stored in bones, but a hormone-like signal that influences how cells respond to insulin. In the body, vitamin D receptors exist on muscle cells, fat cells, and even the pancreas itself, quietly shaping how glucose is handled long before numbers appear on a lab report. From a clinical viewpoint, low vitamin D levels are commonly found in people with insulin resistance and elevated A1C. Doctors do not describe this as coincidence. When vitamin D is insufficient, insulin's signal becomes less effective, and cells require more insulin to move the same amount of glucose. Over time, this increased demand contributes to higher fasting blood sugar and rising A1C, not because the body is failing, but because the signal is no longer clear enough to guide glucose where it belongs. Physicians are careful in how they explain vitamin D's role. They don't present it as a quick fix or a replacement for treatment. Instead, they describe it as a sensitivity enhancer, something that helps insulin be heard without shouting. When vitamin D levels are adequate, muscle and fat cells respond more efficiently, allowing glucose to enter with less resistance. This subtle improvement can reduce the overall burden on the pancreas and help stabilize daily blood sugar patterns. Medical professionals also note that modern lifestyles contribute heavily to vitamin D deficiency. Limited sun exposure, aging skin, darker pigmentation, and reduced dietary intake all play a role. In clinical practice, doctors often recommend testing vitamin D levels rather than guessing, because both deficiency and excess matter. The goal is balance, not extremes, and supplementation is typically guided by lab results and individual health status. There is also a deeper metabolic effect doctors pay attention to. Vitamin D influences inflammation, and chronic low-grade inflammation is a known driver of insulin resistance. When vitamin D is low, inflammatory signals rise quietly in the background, making cells less willing to respond to insulin. Restoring adequate vitamin D helps calm this internal noise, creating a more receptive environment for glucose regulation to occur naturally rather than forcefully. Doctors frequently remind patients that improvements from vitamin D are gradual. A1C reflects 3 months of blood sugar history, and cellular sensitivity does not change overnight. What they look for instead is steadiness, fewer spikes, improved fasting levels, and a sense that the body is working with treatment rather than against it. This patience is part of responsible care, grounded in respect for how slowly biological systems adapt. In the clinic, conversations around vitamin D often shift how patients see their condition. Diabetes begins to feel less like a personal struggle and more like a physiological imbalance that can be supported thoughtfully. Vitamin D becomes part of a larger picture, one that includes movement, nourishment, rest, and medical guidance, all working together to restore responsiveness, to ease resistance, to help insulin's message land more gently and more clearly in cells that are not broken, only overwhelmed and slowly relearning how to listen again. When doctors look closely at long-term blood sugar imbalance, they often find that vitamin B1, also known as thiamine, is quietly missing from the conversation. Thiamine plays a central role in how the body processes glucose, yet it is one of the nutrients most easily depleted in people with diabetes. Physicians recognize that high blood sugar increases the loss of B1 through the kidneys, meaning the very condition that requires thiamine causes it to disappear more rapidly. From a clinical standpoint, thiamine is essential for turning glucose into usable energy inside the cell. Without enough of it, glucose enters the bloodstream but struggles to complete its metabolic journey. Doctors explain this not as a blockage, but as an unfinished process. Sugar remains elevated because the body lacks the tools to process it efficiently, leading to higher fasting glucose and gradual rises in A1C over time. Medical professionals often note that thiamine deficiency does not announce itself loudly. It develops quietly, showing up as fatigue, brain fog, nerve discomfort, and subtle metabolic slowing. In people with diabetes, these signs are often attributed solely to blood sugar itself, when in reality a nutrient deficiency may be deepening the problem. Restoring thiamine helps support the pathways that allow glucose to be broken down and used, rather than circulating and causing damage. Doctors are careful to emphasize that addressing B1 levels is not about forcing sugar down quickly. It is about helping the body complete what it already knows how to do. When thiamine is sufficient, glucose metabolism becomes smoother, and the demand for insulin decreases slightly because cells are better equipped to process the glucose they receive. This can contribute to more stable blood sugar patterns and, over time, improved A1C readings. In medical practice, physicians often consider thiamine particularly important for protecting blood vessels and nerves. Poor glucose metabolism leads to the accumulation of harmful byproducts that damage tissues. Thiamine supports pathways that prevent this buildup, reducing stress on the nervous system and circulatory system. This is why doctors see thiamine not only as a metabolic nutrient, but as a protective one. Doctors also acknowledge that modern diets, refined carbohydrates, and chronic stress increase the body's demand for B1. As glucose intake rises, so does the need for thiamine to process it. Without adequate replenishment, deficiency becomes more likely, especially in older adults and those managing diabetes for many years. This understanding has shifted how clinicians think about nutritional support, encouraging proactive assessment rather than waiting for complications to appear. In conversations with patients, doctors often describe thiamine as a helper that allows glucose to finish its work and leave the bloodstream peacefully. When this process improves, the body feels less burdened, energy improves, and sugar no longer lingers unnecessarily. Over time, this support helps the body move towards steadier control, not through pressure or restriction, but through restoring the metabolic tools it needs to function with greater ease, clarity, and cooperation as cells regain the ability to turn sugar into energy instead of stress, responding more smoothly to insulin's guidance as internal balance slowly begins to re-establish itself. Doctors often raise the topic of vitamin B12 when diabetes has been present for many years, not because it directly lowers blood sugar, but because of the quiet role it plays in metabolic stability and nerve health. Vitamin B12 supports the nervous system, red blood cell production, and cellular repair, all of which influence how the body manages energy and responds to insulin over time. When B12 is low, the body becomes less efficient, and blood sugar control often feels harder than it should. Clinically, physicians are especially attentive to B12 levels in people taking metformin, one of the most commonly prescribed medications for type 2 diabetes. Medical guidelines acknowledge that long-term use of metformin can reduce B12 absorption in the gut. Doctors don't see this as a side effect to ignore, but as a reason to monitor levels periodically, because deficiency can develop slowly and silently. When B12 levels decline, nerve function begins to suffer. Doctors recognize symptoms such as numbness, tingling, burning sensations, and weakness as signs that nerve signaling is under strain. These symptoms are often blamed entirely on diabetes itself, but clinicians know that B12 deficiency can worsen or even mimic diabetic nerve damage. Addressing B12 does not cure neuropathy, but it removes an additional burden from the nervous system. From a metabolic perspective, vitamin B12 contributes to how cells use energy and maintain proper communication. Red blood cells depend on it to carry oxygen efficiently, and without adequate oxygen delivery, tissues become less responsive and more fatigued. This fatigue influences physical activity, muscle function, and overall metabolic health, indirectly affecting blood sugar control and A1C trends. Doctors emphasize that B12 deficiency can also affect cognitive clarity and mood. Brain fog, memory issues, and low motivation may not seem directly related to blood sugar, but they influence daily habits that support glucose control. When mental energy improves, patients are more likely to move, eat mindfully, and follow treatment plans consistently, creating a positive ripple effect throughout metabolic health. In clinical practice, physicians approach B12 with caution and precision. They recommend testing rather than guessing, because deficiency may exist even when symptoms are mild. Supplementation is guided by lab values, absorption ability, and individual risk factors. The goal is not excess, but restoration, allowing the nervous system and metabolic processes to function without unnecessary strain. When B12 levels are corrected, doctors often observe improvements that are subtle but meaningful. Energy becomes steadier, nerve symptoms may stabilize, and patients report feeling more resilient. Blood sugar numbers may not drop dramatically overnight, but the body becomes better supported, less stressed, and more capable of responding to insulin and daily metabolic demands. In this way, vitamin B12 becomes part of a broader strategy focused on long-term stability rather than short-term control. It reflects a medical philosophy that values prevention, preservation, and support of the systems that diabetes slowly challenges. By protecting nerves, enhancing cellular repair, and restoring metabolic efficiency, B12 helps create a physiological environment where blood sugar management feels less like constant effort and more like a natural process unfolding with greater ease, clarity, and strength as the body regains its capacity to function without unnecessary depletion or silent imbalance spreading beneath the surface. Doctors often speak about vitamin C in diabetes not as a treatment, but as a quiet stabilizer in a system under constant pressure. High blood sugar creates an environment of oxidative stress, where excess glucose reacts with proteins and fats, damaging blood vessels, nerves, and cells over time. Clinically, physicians understand that this stress does not show up immediately on glucose meters, yet it steadily worsens insulin resistance and complicates long-term A1C control. Vitamin C plays a unique role here because it closely resembles glucose in structure. Doctors explain that when blood sugar is high, glucose crowds vitamin C out of cells, preventing it from entering where it is needed most. This creates a paradox: the more sugar circulates in the blood, the less antioxidant protection cells receive. Over time, this imbalance increases inflammation and cellular fatigue, making it harder for insulin signals to work efficiently. From a medical perspective, vitamin C helps reduce oxidative damage and supports the integrity of blood vessels. Doctors often point out that diabetes is as much a vascular condition as it is a metabolic one. When blood vessels are inflamed or stiff, glucose delivery and insulin signaling become less efficient. Vitamin C helps maintain flexibility and function within the vascular system, indirectly supporting more stable blood sugar patterns. Physicians also note that chronic inflammation interferes with insulin sensitivity. When inflammatory markers remain elevated, cells become defensive and resistant. Vitamin C contributes to calming this inflammatory background noise, allowing insulin to communicate more clearly with cells. This does not translate into dramatic or immediate drops in blood sugar, but rather into fewer spikes, gentler fluctuations, and improved overall metabolic tone. In clinical discussions, doctors are careful to manage expectations. Vitamin C is not presented as a cure or a substitute for medication. Instead, it is described as part of the supportive environment that allows other treatments to work better. When oxidative stress decreases, the body expends less energy on damage control and more on regulation, repair, and balance. Doctors also recognize that people with diabetes often have lower vitamin C levels than those without the condition, even with similar dietary intake. Increased urinary loss, higher metabolic demand, and chronic inflammation all contribute to this depletion. Over time, this deficiency can quietly deepen insulin resistance and vascular stress, reinforcing the cycle of high blood sugar and cellular strain. In practice, physicians emphasize moderation and guidance. Vitamin C supplementation is typically recommended within safe limits and adjusted based on individual health status, kidney function, and overall treatment plans. The goal is restoration, not overload, and clinicians often remind patients that more is not always better in biological systems. When vitamin C levels are adequate, doctors often observe subtle improvements in how patients feel rather than dramatic changes in lab numbers. Reduced fatigue, improved recovery, and a sense of internal steadiness are common observations. These changes matter because they influence daily behaviors that support glucose control, from movement to stress management to consistency with care. Seen through a medical lens, vitamin C represents an important reminder that diabetes management extends beyond sugar itself. It touches inflammation, circulation, cellular protection, and the body's ability to cope with metabolic stress. Supporting these systems helps reduce the constant strain under which blood sugar regulation operates, allowing insulin, nutrients, and cellular signals to function with less resistance, less interference, and more harmony inside an environment that is no longer dominated by oxidative pressure but gently supported toward balance and resilience as the body continues adapting, responding, and recalibrating its internal chemistry in ways that are often invisible yet profoundly influential on long-term health and metabolic stability without relying on force or extremes but rather on quiet biochemical cooperation that unfolds gradually within the cells as they regain their capacity to manage stress and energy in a more balanced state. If this conversation helped you understand your body a little better, take a moment to support the channel. Subscribe so you don't miss future videos rooted in real science and practical wellness. Like this video if it brought you clarity, and share it with someone who might be quietly struggling with blood sugar or diabetes. These small actions help this message reach the people who truly need it, and together we can build a healthier, more informed community.